COVID-19 is one of the difficult situations which we are facing, which none of us knew what it was, what it is going to be. Today, we are talking about the COVID-19. This is an unprecedented, one of the painfully, excruciatingly painful kind of a situation. The whole world is going through this. I don't know. I think all over the world, on the planet Earth, there are only two words which are being reverberated like corona, flatten the curve. Coronavirus, flatten the curve. These are the two words everybody is talking about. Why is it such a kind of a disruption? No, I said disruption. I don't know whether I can call it as COVID-19 is the mother of all disruptions, whatever has happened so far, at least in the last 1 century. And I also call it a kind of a state which has come as an anomaly, like a state which people are completely at a loss, global anomaly. This is a kind of a global anomaly and such a major disruptions which has happened. What is exactly it? I am looking at it from three different angles. One is this has created a medical emergency, second is a social emergency, and economic emergency. Maybe I don't think I am competent to talk about economic emergency, I'll leave it. But medical emergency, when I talk about medical emergency, this is not a kind of a medical emergency what we talk about, appendicitis or accident. No. This is an emergency for the medical infrastructure and one. Second is a medical treatment load. Infrastructure. The entire medical infrastructure all over the world, even in the most developed countries like US, has today, it's sort of collapsing. If I can just, show you this particular, graph, which this is got from the Johns Hopkins Coronavirus Research Center. I think you are able to see this. If you look at this is in the New York State. We have here on the different years, because of flu, what are the deaths which happened. If you look at this here, the lines here, which are flat lines, which shows that on an average in a week, about less than 100 people die of this kind of viral infections which you see here. This is what happens in the New York State. And there's one line which you see above. This is the number of deaths. This is the weeks. This is one line if you see in the New York State. In the last half a decade, on an average about 2,000 people die in New York State. It could be because of infections and heart attacks and cancers and all kinds of medical mortality. It's about 2,000. So the medical infrastructure is built to take care of this. But now suddenly you see the red line there. This is what COVID is doing. This is what coronavirus is doing. Just in a week, more than 200 deaths per day. Where will the infrastructure can be able to manage it? You need 1 million ventilators. You need millions of resource personnel. They are not able to. That's why infrastructure is breaking down. The next point is after the infrastructure, we are looking at the treatment. Number one, there are only two things. One is current treatment. We are lost. People are talking about HCQ, hydroxychloroquine, and then azithromycin. These are not well-tested, evidence-based medicine, but in the last resort, we are holding on to that. Good, go ahead. If it helps, it's good. Second is prevention. Vaccine. We all know that vaccine is not going to come in the next at least 6 months or more than a year. So this is where infrastructure is collapsing. The treatment options are not there. That is where the kind of a medical emergency all over. So there's only one thing. You don't have the treatment. So what do? Prevent it. How do I prevent it? Prevent the development of a new person, a person getting infected. So see that the other person is not getting infected. That is what we call as the primary prevention. So how do we do it? Social distancing. This coronavirus, we know flus. Coronavirus seems to be one thing. There are two very specific things. Number one, it seems to be a super fast spreader. We have seen flus, we have seen viral infection. This seems to be spreading super fast from person to person. One person infecting 100 people, 500 people. Number one. Second thing is super spreading. Second thing is pan spreading. This is pan spreading is because of the global village, international travel. The one virus which Very rapidly it spread. Second is because of your international travel, the whole planet Earth is today infected. That is the monumental challenge this coronavirus is giving to this world right now. This is unprecedented. You may ask me, see, doctor, as a doctor, can you... I've been practicing psychiatry for 4 decades. I don't have an experience in this kind of a thing. People talk about Spanish flu 1918. That time I don't know how much medicine has really developed. Psychiatry, there is no medicine at all. Then talk about Great Depression 1930. Even then, it's not a medical emergency, more of an economic emergency. So we talk about medical, social emergency and economic emergency. Let us talk about social emergency and social distancing, maybe again later. Corona is throwing a monumental challenge to the human beings, especially not just the medical people, the administrators, politicians. They are like the heads of state. They're at a loss. Now, looking at how do we prevent the spread? See that there is no contact between two human beings. How do we do that? Social distance. This is a new term. Man is a social animal. So it's supposed to be more socializing, more interaction supposed to be. Suddenly somebody said that social distancing. Stay home, save lives. When I first heard that, stay home and save lives, it's an oxymoron. What is this? Staying home is not doing anything, total inaction. And inaction which is required, desired and then requested to save your fellow human being. It's a kind of a shock to me. I don't know whether I can talk about it, but this inaction is the most needed action to prevent, to tackle coronavirus. Brings to me a kind of somewhat, not like it sounds familiar, the Indian collective unconsciousness. All of us remember the non-violence movement of Gandhiji, not doing anything, the most potent weapon fighting against the British Empire a century before. Non-action, most required action. Non-violence, the most potent weapon. I don't know, but I was just thinking about it and some kind of a similarity which has come to me. Stay home. Look at it. This is the best thing. I think now everybody we talk to, no time doctor, exercise, no time doctor, relaxation, no time doctor. Everything used to be no time doctor, no time doctor. But now you have all the time in the world. It's one of his writings. Rabindranath Tagore talks about surplus of leisure. Civility is the beauty of behavior. If you have to express yourself in a civilized way, it needs courteousness, time, and he says that you need surplus of leisure. Now we have, I think for the first time in this rat race, in this 21st century, people are looking at surplus of leisure. But the point is, are we utilizing it efficiently, correctly is going to be the most important thing. It's not going to be easy. Your children do not know, they have never experienced this kind. They had holidays, but they were never not allowed to go out. And then here, as the family person, as the head of the family, I want the head of the family to take care of this stay-home situation. Number one, take care of your children, guide them. See that they are reasonably occupied. Very much be aware of digital abuse. Second, your elders, you have to be supportive to them. They are worried that this mortality in elderly people is high. So give them support, but keep them physically somewhat separation, distance. Please maintain that. And the most important thing, marital relationships. Spouse and you should be speaking in one voice. You should build the relationship, strengthen the relationship. This is, I am also telling in the context of a sweet home. Have a clean home. Sweet home is the first thing to reduce stress in all the persons in the family. Today we need the most potent weapon against this coronavirus is building up your immunity so that your antibodies can take care of the coronavirus infection. For this, you need your immunity. Stress is one of the most important things which can disturb our immunity. Lower the stress. have a family bonding and then family get together. And then family being together, your immunity levels goes up. But this does not happen just randomly, because we are never used to this kind of leisure, plan, time management. For exercise, for relaxation, children, hobbies, book reading, music, and then how to keep everything occupied, you need to have a time management, which is going to be the most important thing. And in doing that, you are strengthening yourself, you are strengthening your family relationships, and also you are doing a service to prevent the corona infection. That is how we have to look at. That is how only way we can manage, or we can sort of deal with this monumental challenge this is coronavirus is throwing at us. Unfortunately, one more thing, it's almost like even the crematoriums infrastructure is breaking down. People are dying. There are no places to bury them or cremate them. That's what is happening in most of the European countries. Unfortunately, in our country, it has not come to the stage. In US and Europe, it's coming like that. The bodies are lying down. The last thing we can do to our fellow human being is that the last rites should be done, and the family should be together to perform the last rites. But even that's not being done. Now we can understand the gravity of the situation. But at the same time, I'm not talking about all negative things. The positive thing is that the worst thing in this coronavirus thing is it's not highly fatal. It's only 3%, 2% where the deaths is, except in the elderly. So let us all be together in staying at home and then fight this virus, which is the most important. We did talk about staying at home. We were till yesterday talking about this being a global village. Everything, travel, and then digital communications, everything has become. Suddenly, this global village, now we are forced to limit ourselves to our tiny houses. What I'm thinking about it, the global village is being broken down to tiny geographical micro islands of each one of us. At this point, I remember I think it's a poems or one of the songs which I heard. Vasudhaika Kutumbam Nadi, Ekaki Jeevitam Nadi. That shows Vasudhaika Kutumbam means the whole world is my family. But Ekaki Jeevitam, I am living alone. This maybe I'm stretching it a little bit more. That's what the situation. Now it is like that. When you say stay home, you're not alone, it's a family. Social distancing is between the different families, but within the family, it's not family distancing. That, please don't forget that. And at this point, another idea also which was striking my mind is that the first time when I heard the virus break out in China and a city, Wuhan, has been locked down. It's a city, it's about 1 crore population. It's almost similar to our Hyderabad, Secunderabad kind of population. It's locked down. When I heard the news, I couldn't believe it. How can somebody lock down one city like that? Then, I'm sorry, please don't misunderstand me. I was thinking this is possible only in a country which has got communism in its own, administrative head. Only in communist countries it's possible because they can enforce. And then Hubei lockdown. I said, look, I was thinking about it. My God, if the kind of situation can come like this, is it possible in India? I was thinking it's impossible. But today, I think I must thank and then really now say namaskar to all the Indians now. Today, India is locked down. 1.3 billion, not 1 crore. There may be small incidents, but 80% of the people are respecting the lockdown. This is not literacy. 50% of our population in the villages, they are illiterate, they may not understand this thing, but the leadership, I think I must praise our Prime Minister Narendra Modi and the local, our Chief Minister, whether it is K. Chandrasekhar Rao or other people, the kind of a leadership which we have, and more than anything else, every one of us, all human beings, they are standing united collectively. I can't believe it. This amount of resilience, what I can talk about in the Indians, where has it come from? Where is the strength come from? Where is the unity this has come from? Again, maybe I'm talking a little bit too much about some of these things. I also remember We have the potential. When there's a demand, when there's a situation, when there's a need, we all stand up and then hold on to that, which is called a kind of maybe Hanuman complex. Lord Hanuman, he was not knowing his strength just before he went to Lanka in that mythology, Ramayana, people talk about. He has to realize his potential. Now India is realizing its potential. Staying inside, staying poverty. Even today evening I may not have the food, but I'm staying at home. 80 to 90% of Indians are staying at home. This is a collective tribute to the Indian togetherness and then collective unconsciousness of Indians, which many European countries, so-called educated, developed countries are not able to do. It's a miracle to me how we are able to achieve, but we are doing it. I salute each and every Indian in doing this, and then thank you so much, and I really salute you for the kind of resilience you are showing in that, which is the only way we can fight this virus. Let me talk about, as a professional psychiatrist, everybody is worried. This is an unprecedented situation. There is pressure, there is stress. What's going to happen? What are the different kind of problems we are going to have? How are the people going to face that? As I have already told, Indians have that resilience. Do you ever remember a period when, in the recent past, and I'm not talking about only this religion, Ugadi was not celebrated, Sri Ram Navami was not celebrated, and Tirumala temple has been closed for such a long time. Vatican is closed. Mecca is closed. All the religions, all over, everywhere it is closed. With this kind of a sudden kind of a thing, how does a human being, till yesterday he was looking at a lot of other avenues for his ventilation, for the kind of support, a big brother kind of thing, how is he managing now? We manage. Mostly we have the problems, like as I was talking about, adjustment problems at home, for which I say that I put the responsibility on whoever it is, head of the family. One person, you have to take charge. This is the time as the Prime Minister is taking charge of the country and efficiently impose or not efficiently bring out lockdown. Each head of the family, you have to take your own unit and bring it to some kind of a resilience. You have to take the lead. Small adjustment problems will be there. Your children never experienced this. Your parents know all the time at home. More the time, there can be small issues of irritability. And this is the problem with this corona thing is, it is not one day event. You have earthquakes, you have fire accidents, you have tsunamis, it comes and goes, but this is not like that. It's coming and then going on and then going on. Every day you watch the TV, another 200, another 500. It's a continuously, every one of us, the anxiety levels are slightly high. We are staying at home. We have surplus of leisure, but that's not a leisure like. There is some anxieties, anticipatory anxieties. Will I develop this? Will I have this? Anybody in my family will have this. This is the kind of anxiety. So normally, let us think that this is my state of, general state of arousal. Now, everybody's state of arousal is slightly higher, which I call it the hyper arousal state. A noise, I'll get threatened. Yeah, something happens, I'll be a little bit of startled response. Slightly high only. You can manage it. But in this state of slightly high state, the sparks can fly very easily. The snapping is very, very fast. Arguments can happen very easily. A children creating noise, you get shouted at them. Your father or mother asking something, your wife says something. So this is where adjustment, this is where I see the biggest role for emotional intelligence. You need to manage your emotions intelligent way. Your anxieties, you need to keep it. Don't watch TV continuously. You know there is a problem, but you keep it under control. I am mostly worried about one particular emotion in the present situation. Not the anxieties, not the fear. Anger. This hyper-arousal, as I told that snapping is fast and sparks can fly, anger, arguments and anger, I think we have been hearing about. Domestic violence is on the rise, which is okay. That's because of this. Anger. Anger makes us numb. It's, if I can say that, maybe if I can quote a sloka, something like Bhagavad Gita, it has come. Krodhat bhavati sammoha. Sammoha smriti vibhramaha. Smriti vibhramsa buddhinasa. Buddhinaso pranasyati. Once you're anger, all your emotion states going to numb and you come into a state of like your intellectual powers come down. That is the time you behave in a totally unpredictable, inhuman kind of a behavior. So keep a watch on your state of anger. Do something about it, which is going to be the most important. Doctor, how do I manage? It doesn't come suddenly like that. Do some exercise, sir. Little bit of relaxation, sir. Whatever way you want. Go for a walk. Do the exercise in your own terrace or down only walking. Some hobbies. Music, any amount of music will not do any harm. Read some books, play with your children. These are all easy things to tell doctor, but how do we practice? Sir, we are forced to. It's easy to ask somebody to stay at home, but we are all staying at home, sir. Nothing is more problematic or more unmanageable than this. So, every one of us are doing that. You please do that also. Build up your emotional intelligence. That's going to be the most important. Once you have that, your adjustment problems will settle down. Try to find a different kind of life within that close world family. Of course, there are anxieties, but this is the time you show the strength of it. Here, one important point I'm trying to say is that sleep well. It's not that something new I am telling. We all have to sleep 7 to 8 hours. Sleep well. How do I do that, doctor? Some specific sleep rhythm you have to maintain. Don't sleep in the day just because you're at home, nothing else to do. Don't sleep in the post-lunch session. At the most, you have about 15-20, not more. Keep a schedule like morning I wake up at 6:37, it's a summer time. Do a bit of a walking exercise, yoga. And then, as far as possible, avoid coffees and teas, especially after 4 o'clock or something. As far as possible, avoid alcohol. These are the things which make a regular rhythm. After 10:30, 11, completely switch off. No TVs, no mobiles, no pads, at least for some time. Be in relaxed. You read a book. Listen to some music. But no like a visual media which can sort of. And now the problem is that digital. Now why it is a problem? At this point, a lot of parents come and ask me, doctor, he's using mobile very too much of it, he's using. But one thing which strikes me is that this is supposed to be a materialistic world we are all in. Everything comes with the money. Look, your Google search is totally free. WhatsApp is totally free. Your Instagrams, this and then Facebooks are all free. You have something which is totally free except for that internet, this thing which is coming up. So it's not going to be easy for somebody to stop. And there's a variety of things what we have in this. It's a time pass kind of a thing. So we need to exercise some restraint, and that we need to have some self-restraint, and you be a model to your child so that children follow the parents' model. So these are some of the things which you have to do very specifically planned way, time management and managing this. It doesn't happen randomly. Do it. I think you will be able to find a better life, new life in this so-called restricted period. I think that's going to be the most important thing and it's most needed. We are talking about this thing, the one important point here, drug abuse, substance abuse. There are two things. People who are addicted to alcohol, already the cut-off period, they have gone through withdrawal periods. I am also worried about the social drinkers and then smoking. Boredom, sitting at home, you smoke more number of cigarettes. You eat more pouches of gutka. You take drinks a little bit more regularly. Please be cautious about it. Please, because that's a danger. Number one, it's going to spoil your health. That can be the reason why wife and husband, there can be arguments, and you are going to be a model to your children who are there, and also passive smoking. So stop that. Digital, be very clear about how much of time you let your children use, how much of time you use. Otherwise, that also can be a problem. Like anxieties, worries, depressions can happen, but here let me tell you, mild anxiety, mild worries, mild adjustment problems, mild abuses can happen, but a major psychiatric disorders like schizophrenia, bipolar disorder, psychosis, very unlikely. With stress, people develop this. Already who had this, there can be an exacerbation, but you need to have something like a genetic vulnerability. People who are vulnerable only develop this. It's not that everybody is going to develop major psychiatric problems. So don't worry about this. But one condition I need to talk about here is that OCD. If I don't talk about OCD when I'm talking about this particular state of stay home, OCD is a peculiar condition in psychiatry where the person is morbidly afraid of contamination and germs, so he keeps cleaning. Now, all of us clean, but here the cleaning is 100 times. 3 times, 3 into 3, 9, 9 into 3, 27, 27, it goes like that. When they go to the washroom, they take a few hours to complete. But now the peculiarity is that we are all told, wash your hands more frequently. At least a minimum of 20 seconds. The more number of times you wash your hands, it's more better. Don't now touch the other person. Anything you touch is going to be, you have to wash it. So it's almost like until yesterday I would have called the same person as OCD. Today we are trying to tell about this medically, see that you have to do this. So when this kind of OCD, the problem is they have doubts. Maybe the virus would have fallen here and it is still contaminated. Maybe something I touched this person and it's contaminated. Maybe this person has come here, sat here, you would have been touching it. So there can be a possibility of exacerbation of obsessive compulsive disorder symptoms. This is something which can be easily managed with some dose titration, and then maybe some small thing like counseling that can help. And then beyond that, there is nothing to worry. As I tell, phenomenal resilience all of us have, human beings, which we are showing to the rest of the world. Indians are showing it. Keep it up, stay home, stay healthy, and then build up a strong family relationship. Nothing like a family as a unit is responding to that. This is a pandemic, like a catastrophic thing. But I don't know whether the world is going to be a new place after this, changing something. Let us look at one or two small points. All Indians are asked to wash their hands repeatedly, regularly. So the possibility of infectious diseases later in India is going to come down, like a tuberculosis, flu, and then amoebias and also can come down. Your drinking has become less, your smoking has become less, you are not eating outside food, you are eating homemade food and 3 times food. So the so-called diabetes may come under control, BP may come under control, cholesterol may come under control. When these things are under control, your heart attacks may come under control, because life is a little bit more regular. Vehicles are not moving, nothing is moving, so pollution has come down. There may be clean air, good food, healthy food, habits have come down, no restaurants, no late nights, nothing like that. So is there a possibility that infections disease in India are going to come down? We do not know, maybe. Is there a possibility even non-communicable like diabetes, hypertension, cardiac, are they going to come down? We don't know. The possibility is there. We don't know. Let's hope. Every crisis has throws up some opportunities. Whether this is good, at least one thing is good. The cleaner India, Swachh Bharat, this has become much more enforced, and then everybody is voluntarily doing it. So out of this kind of a catastrophe, let us see some ray of hope. Let us stay together. That's the only way to break this cycle of coronavirus infection. I'm sure that we are going to break it. What we have done in the last 3 weeks is absolutely phenomenal for a country like India. I'm sure we can do it for another 1 month or 1.5 months. Let us do that, fight this, come out clean, come out with less infections and less morbidity. Thank you all.